Dental care is one of the worst pain to manage. It's estimated that 60% of the population is afraid or anxious before going to the dentist. But pain is not a fatality, and there is a real challenge for our patients in optimizing pain management before the procedure and for our caring reputation, because we are easily judged according to the anxiety or fear, especially for the dentists. As parallels can be made between our two disciplines, I'd like to share my best practices with you. We memorize pain for better and for worse. In a clinical study in 1997, Taddeo and colleagues clearly demonstrated that the newborns who were circumcised without local anesthetics cried significantly more and exhibited greater behavioral and physiological distress to later injections than the newborns who were circumcised with anesthesia and those who were not circumcised. A randomized trial in lumbar puncture and bone marrow aspiration was built on 2 steps. During the first step, half of the patient received fentanyl and the other half only placebo. During the second step, patients of both groups were given fentanyl. The treated group felt low to moderate pain during all the procedures. On the contrary, the group who got placebo first experienced moderate to high levels of pain even after receiving the fentanyl. The pain memory is so intense that it can prevent the action of powerful anesthetics given afterwards. There are several potential analgesics that can either lessen or stop the pain if given early enough. Classically, we can prescribe hydroxyzine or benzodiazepine for adults only on the condition that the patient is not alone before and after the procedure. It means that the patient cannot drive by himself after the procedure. Nevertheless, paracetamol is always useful for mild but also severe pain thanks to its opioid-sparing effect. The oral form of paracetamol reaches peak levels within 30 minutes. Non-steroidal anti-inflammatory drugs are effective for mild to moderate pain, but they should be used with caution for patients with coagulopathies, ulcers, renal disorders, pregnant women, chickenpox, severe asthma, etc. These medications given before the procedure are effective only on the pain level post-procedure. Behavior and body language are also relevant in pain management. Looking straight at your patient, welcoming him with a smile, showing carefulness. Generally, explanations by themselves can reduce anxiety, and your reassuring tone of voice is as important as what is said, especially when addressing children. It's also interesting to show pictures of what you are saying because patients tend to focus on their fear of pain without listening to the rest of your explanations. Moreover, there are interesting tools to know and display in the office. When dealing with children, it's always magic to blow bubbles, to sing a song, and wearing a funny pin distracts children. Of course, you should also avoid showing the needles. Tablets and smartphones offer a wide variety of applications, games, videos, and even virtual reality can reduce anxiety before dental procedures. Easier, but as efficient, is to give the patient the opportunity to listen to his favorite music. Even simple sounds are proven to be helpful. At last, in order to face pain, I reach out for support. It has been proven that parental presence influences pain threshold enough to divide the dose of anesthetics by 2. The wife, the daughter, a friend can be a good partner if you let them help with the pain management process. It works very well on the condition that the patient agrees and that the partner is trained by the professional. Without training, a parent could be commenting the surgery and the child could react badly. Thank you for your attention. I was happy to share with you my good practices on pain management before the painful procedure.